Now, from my point of view, this is one of the nicest definitions I've ever come across about clinical audit, in that it's the systematic review and evaluation of practice against a standard. And that's a very key issue, against a standard, because it's a bit like having a high jumper running at 2 posts in the air. If there's no crossbar, everyone wins. Everybody can get through that. But if you have a crossbar, you know what you have to aim for, and you also can raise and lower that crossbar. But that's one of the important things. And the second thing is that it's about improving patient care. And that is, if you're not improving patient care, and take it for granted that you may have to carry out a clinical audit as part of your CPD, but that's one driver for it. But this is the most important driver for it. So everything you do should be about trying to do that. Now, the better definition of clinical audit is, like the ad says, it does exactly as it says on the tin. And I think that if you ever want to say, is this audit or is this research, just ask yourself the question, is it doing what it says on the tin? And for those of you who are maybe nerdish amongst any of us here, what did it say on the tin? Ronseal quick drying wood varnish dries in 4 hours. And the 4 hours was the standard. And so if you apply that to what you're doing, are we following a standard? Do we know what the explicit standard was? So it didn't dry in 4 hours and 5 minutes. It didn't dry in 4 hours and a half and then 4 hours and 30 minutes. It dried in 4 hours or less. So everything we must be doing is, are we following the standard?